Hi, everyone, and welcome to the Women Belong in Medicine podcast, where we will be diving into unfiltered and honest conversations that promote a better understanding in the healthcare field. This podcast is dedicated to empowering and supporting pre-health women on their journey towards becoming future healthcare providers. Whether it's pursuing careers in medicine, dentistry, nursing, or any other health-related field, we strive to provide a nurturing environment that empowers and uplifts aspiring female health professionals. In each episode, we will engage in candid discussions on a wide range of topics related to the healthcare field. So stay tuned for insightful conversations, advice, and a closer look at how the undergraduate American Women's Medical Association is making a difference in the pre-health landscape here at USF. Let's get to it. Hello, everyone, and welcome back to the Women Belong in Medicine podcast. We have some exciting things to talk about on today's episode, including a special guest that we will get to in just a second. My name is Olivia, and I am your host. And I have two more people joining me today, Bethany and Wedline. They're going to introduce themselves.
Hello, everybody. My name is Bethany Jowers. I'm a senior at USF. I'm studying biomedical sciences and Spanish. And I have been the president of UAMWA for 2 years now. So I'm so excited that Olivia has gotten this podcast going, and I'm grateful to be joining today.
Hi, all. My name is Wedline. I am the social media chair of UAMWA, and I'm a junior at USF studying biohealth sciences with an IT health concentration, and I'm very excited to be here as well.
Fabulous. Thank you both for being here. I appreciate it. I'm very excited. Now, today we do have a very special guest. She is a distinguished physician assistant and has been for about 11 years now. She also has a doctorate in medical sciences. She is currently an assistant professor for the Physician Assistants Program at USF Morsani College of Medicine and a physician assistant at Johns Hopkins All Children's Hospital in blood and marrow transplant. She also has served on the Physician Assistant Admissions Committee at USF Morsani and has recently won an award in 2023 for Outstanding Didactic Instructor of the Year. Now, with that being said, I introduce you all to this wonderful person, Dr. Lauren Adams.
Thank you. Thank you very much, Olivia. And I'm very excited to be here today and to talk with you all about the physician assistant profession, what it means to be a PA, what my typical day is like. I will just go ahead and preface that every PA's job is a little bit different. So that's one of the great things about being a physician assistant is that no two roles are really alike. So there's a lot of variety out there. I always like to tell people that you can really make it whatever you want it to be. There's always room to grow as a healthcare provider and as a PA. So I'm excited to talk with you all about some of that today too. And just a shameless little plug, I always like to let everyone know that I'm a USF alumni too. I graduated from USF with my bachelor's degree in environmental science back in 2010. So definitely love USF and I'm really happy to be here today.
Yes, we appreciate you being here. We're very excited to talk with you. So we are going to move into a little bit of some questions that we have for you, Dr. Adams. If you would like to talk a little bit about your education and where you got your degrees, other than the one from USF, like you just said, if you could add on to that, that would be wonderful.
Sure. So I did my physician assistant education at Nova Southeastern University at their Orlando campus. And I started there in 2011 and graduated from there in 2013. Their program is around 26 months, which is a little bit longer than the standard or some of the 2-year programs. The USFPA program is 24 months. Or I guess maybe Nova was even 27 months. Sometimes time gets away from me after that many years. And then I went into working immediately after graduating and then went back to school in 2017 or 18. I decided to pursue a doctorate degree, really to further my just knowledge of advanced professional practice in general. And I did an online program through the University of Lynchburg and finished my doctorate degree there in really the end of 2019, beginning of 2020. And that was just something that helped me to get a better understanding of our healthcare system in general. You know, PA school is very fast paced, as you may have heard from anyone that you know that has gone to PA school or is currently a PA student. And there is only so much time to focus on things like how insurance works, medical malpractice type things, you know, some things that you hope to never encounter, but things that really just give you more power by understanding how things like that work. You know, knowledge is definitely something that's powerful. And so I did learn a lot through that program, focused a lot on global health disparities and how advanced practice providers can help play a role to bridge the gap for healthcare, not only here in the United States, but also internationally. So that's really my personal education background. I'm also, of course, very interested in educating other people. Like you mentioned, I'm an assistant professor at the PA program here at USF. I did do that full time for a couple of years and have since transitioned more into working full time clinically again, but I do still teach a lot of the curriculum for the first year students at USF in the PA program. So I'm committed to being a lifelong learner, which all PAs really have to be, which is good. It's one of my favorite things to do is to keep learning. And so I'm a big fan of continuing education and making sure that, you know, students understand what it is that we're teaching them.
That was wonderful. Thank you for that. So I kind of want to talk a little bit about what you do, what you have done clinically. Like, what type of experience should an undergraduate try and get into that PA school requires?
That's a really good question, and a question that we get often from pre-PA students, rather. I think that the nice thing about it is that there's not just one answer to that question. You know, I am a really firm believer that any type of healthcare experience before PA school will benefit you somehow and will help to set you up for success as your future career as a PA. There are certainly some positions that we see students or interview students that are coming into PA school, you know, things like being an emergency medical technician, a paramedic. Those are some of the more hands-on type of roles that pre-PA students will do. To use myself as an example, I was a certified nursing assistant before I went to PA school and did just a variety of things, like some home health care type things. I did some things in assisted living facilities. There are students, something that's gotten more popular over the last several years are medical scribe positions. So a lot of students are scribes in the emergency room or in, you know, dermatology offices, or even being a medical assistant. So, you know, all that to say, there are a lot of different medical roles that are very applicable to working in healthcare in general and to being a PA. So I think that any sort of healthcare experience will benefit you, regardless of what healthcare profession you end up pursuing. But you know, there are some that end up being more applicable, you know, some where you get more experience with history taking, for example. But I do like to remind everyone that when you come to PA school, it's also our job to teach you how to be a PA. And so we certainly don't have the expectation that everyone shows up and already knows how to do a whole history and a whole physical. And I like to joke sometimes with our students and say, if you already knew how to do all these things, then we wouldn't be here. We wouldn't need to be here teaching you these things. And so I think that you can learn something from any type of healthcare exposure that you have. And I know that was a little bit long-winded, but I don't think there's one perfect pre-PA job or pre-health professions job.
No, that was wonderful. Thank you for that answer. To clarify, would you say this has kind of been my personal philosophy based on some advice I received a while ago? But would you say that these kind of experiences, especially like clinical experiences for people who are aspiring to be a PA or aspiring for other health professions, it's less about, getting that training and, working towards being a PA and more about finding what you like and making sure that this is the field for you because you won't be able to be involved on that level yet as an undergraduate? Would that be semi-correct to say?
I think I understand your question. I think that you have most PA programs, and I don't want to speak for all of them because I'm not privy to the requirements for all the PA programs that are out there, but nearly all of them require some type of healthcare experience prior to coming to PA school. And so I think my best advice would be to get experience not only to help the healthcare field, but also to make sure that while you're getting that experience, you're also getting exposure to PAs and advanced practice providers to make sure that for lack of a better way of explaining it, to make sure you know what you're signing up for.
Mm-hmm.
I think that we're exposed to a lot of different things, especially with how popular social media has become in the last even 10 years. Instagram was never a thing when I was in PA school. And now, sometimes it feels like people are doing certain healthcare jobs because they want to be able to post about their whatever latest scrubs they're wearing or, what their day is like, which is fine. But I think that it's important to know that healthcare is a really difficult field and it is certainly not glamorous all the time. It's very emotionally taxing and physically taxing. And so you need to have exposure to those sorts of things before going to PA school, and also make sure, to your point, Bethany, that you are exposed to things that will benefit you down the line, but also to know what you're really getting yourself into.
Mm-hmm. So just to continue picking your brain on the PA admissions process, I wanted to ask what qualities, so we talked a little bit about the practical experience that you're looking for on the admissions committee, but what kind of qualities or more soft skills do you see in perhaps applicants or interviewees, and then your students and your colleagues that you say would make a good physician assistant, and then even in a more general sense, a nurse or a physician, like a healthcare professional? What qualities do you personally see that you would like to highlight?
That's a good question. And I think that it's an even better question because it's not something that's easily put down on paper. We can tell you what the admission requirements are and what GPA you need and what GRE score is recommended, for example, but it can be harder sometimes to identify those other talents, especially in an interview process. We only spend so much time with the students. And so I think that that's something to keep in mind as you're applying to graduate school, whatever the health profession may be, whether it's you want to be a PA or an occupational therapist or a physician or a physical therapist, whatever that may be, making sure that you give yourself credit in your application to all the different things that you have done in your undergraduate career, whether that's volunteering or other type of community service work, making sure that you have those sorts of things outlined in your application. In terms of things that programs are looking for, I think one of the biggest characteristics that is great to have when you're working in healthcare, and it may sound a little bit cliche even, but it's to be a team player and also to make sure that you're flexible. No 2 days of work look exactly the same. And so having the ability to change under certain sets of circumstances and approach things differently, to work on days where maybe you don't have as much help as you wish you had. I think just having flexibility in general in all areas of your life will contribute to making you a strong healthcare provider or, health professions type career. I think that if you line up all 50 students or, 51, 52 students, all the students in a PA program are very different. They have different backgrounds, different healthcare experience. And to me, that's one of the things that makes being a PA so great, is that no two PAs really look alike and seem alike. And so I wouldn't think that there's a perfect recipe for becoming a PA, which is something that I think makes it unique. Of course, there are the required things, like I mentioned, like most programs have a lot of overlap in terms of what core courses they require. There doesn't tend to be a lot of flexibility in those, but that serves a purpose, right? Because we know that you need to have accomplished those things in order to be a successful PA. But in terms of like prior experiences, personality traits, the biggest things that I would identify would be being a team player. I think that would be the biggest one. And like I said, I know it sounds cliche because we talk about the teamwork model of healthcare, but I really can't overemphasize the importance of that and how lost we would be without a teamwork approach every day.
Thank you for your answer. I have a question about with the growing field of like PA and just like healthcare professions in general, now more than ever, like what do you see as the future for healthcare or like different healthcare careers or even the PA field?
That's a really good question. I think a lot of the future of healthcare will depend on where you're practicing. In the Tampa Bay area in particular, I think sometimes it feels like there are so many different health professions programs that it can feel a little bit overwhelming at times. Even when I think about the number of PA programs, even in the Tampa area, there are quite a few, which is great. We certainly need PAs, but that is much different than it would be if you were in the Midwest somewhere where maybe there are fewer programs or just fewer people in general. And we have a huge population in this area, so definitely have the need for a lot of healthcare providers. I think that healthcare, one of the great things about it is that it's continuously changing for the better a lot of times. In the particular field where I work, we're always happy and feel lucky that it's changing because we can offer our patients more treatments. We have better access to therapies for like cancer, for example. And I do think that as technology continues to evolve, we'll definitely see things with the risk of straying too far off topic. Things like artificial intelligence or AI, we are even seeing things come out about that and how AI can be useful in the field of radiology and how computers may be able to read a chest x-ray better than a person. And I'm, again, not saying that I know for sure that's the case, but I think that that's the world we're looking to in the future. We have a lot more precision medicine now and the ability to really treat each patient even more individually than we have been able to historically because of our abilities to do more detailed diagnostic testing. And so I think that it is a lot to learn. There will certainly be a steep learning curve with all of that, and it may change quickly sometimes. But that's one nice thing. I think that we're all pretty adaptable. I think about even 10 years ago, before electronic medical records were even a really popular thing. And now, to give an example, when I started my current role in bone marrow transplant in 2017, we were still writing our chemotherapy orders on paper, and we didn't switch our chemotherapy ordering to the electronic medical record system completely until I think 2020, maybe 2019, somewhere around there. Don't hold me to it, but my point is that that's pretty recent, like that we were still handwriting chemotherapy a couple of years ago. And so I even think about how things have changed over time since I've become a PA, and I almost feel like it's, kind of an exponential takeoff sometimes. And so I think that most of the changes in the future will have to do with the changes in technology.
Yes, I definitely agree. I went to a conference a while back last year, and they had an entire room dedicated to all of the new technology that was coming in the surgical field. And I thought that was very interesting to definitely see. They also like compared the old technology to the newer technology that was surfacing today. And I thought that was very cool and also a little scary, but because a lot of the technology was robots doing the surgery, and it's very mind-blowing.
It
But
is.
talking,
And I think it feels funny to think about, at least for me, it feels weird sometimes to think about that. But when you see how precise the surgical
yes.
technique can be,
Mhm.
it makes sense that we want to use it, right? And the
Yeah.
outcomes for patients tend to be better. Recovery times are shorter. Patients have their hips replaced and go home the same day, which I can't speak fully to because I don't work in adult ortho, but I just know on a personal level of people that have done that. And I can't believe it, honestly.
Yeah, it's definitely insane. But talking about the future, there was a question that I wanted to ask. It was more geared towards kind of going back to like the students. What advice would you give to a student in the pre-health world now that fears rejection? So, like when applying, what advice would you give to them if they get rejected the first time and then they get discouraged or something like that?
That's a great question. And I think something that we tend to encounter, I even work with some individuals who want to go to whether it's PA school or nurse practitioner school, and they're like working at the hospital in a job as a patient care tech, for example, or a bedside nurse. And I think that the most important thing is to not let one rejection cause you to give up. There are plenty of people out there who apply a couple of years in a row before getting accepted to a program, and not just to PA programs, but to any of the health professions, whether it's medical school or pharmacy school, whatever it may be that you want to do. And I think that there are so many things that can contribute to a possible rejection, whether it happens to be other people that you're up against that year, or, if you had an interview, maybe you had a terrible day and you just didn't, you weren't yourself for some reason, you had other stuff going on. We all have other lives and external things that contribute to our day-to-day activities. I would encourage everyone to try, and I think it's hard. I say this now as someone who's been working in healthcare for a long time. And so I think that it's one of those things where it's easy for me to say because I'm not in your position anymore, but I was. And I do remember being afraid of rejection and, having the stress of juggling all these things. Like you're finishing your classes to graduate and you have to do all these applications, and you need to do shadowing, and you need to get letters of recommendation, and you also need to sleep and maybe work and remember to eat dinner. And so it's a lot. And if anyone tells you it's not a lot, I don't know, they may not be being truthful with you, because it's overwhelming to even think about. And I remember how overwhelmed I felt all the time. And so I think the biggest thing is to not give up on yourself. If you really want to do whatever program it is, to commit yourself to doing it and look at the requirements of the program. One thing that I like to talk about is that not every like health profession's career is for everyone. So not everyone who makes a great pharmacist would make a great occupational therapist. Not everyone who makes a great PA would make a great physician. And it doesn't mean that everyone in that role is incapable of doing the other thing. It just may not be the best fit for them. And so I think a lot of it's being honest with yourself and being true to yourself about what it is that you want to do and why you want to do it, And then also knowing your limitations, knowing that if the program you're applying to has a minimum GPA and you are several points below that, it doesn't mean that you're not capable of doing this, but it means that you should look for programs that align with what you have on your transcripts and your CV or your resume, what have you. So I think educating yourself on the different programs out there, I should have done a little more homework and had the numbers for you about how many PA programs there are, for example, in the country. And there are tons. And sorry for not having the number, but my point in saying that is that it's nice to be able to stay here if you can, if you want to stay here, and if you're from Florida, your family's in Florida, of course that's most desirable. But in the grand scheme of things, and hopefully in the grand scheme of your entire career, a couple years in graduate school won't define everything about your future. And so if you have to move somewhere for a couple of years because a program in, I don't know, Iowa or Kansas or wherever it may be is the best fit for you, then that's worth looking for. And so I think that making sure that you know what the program requirements are, what the minimum requirements are, do you have enough healthcare hours? Do you have a GRE score or a GPA that aligns with the other students in the class or the minimum requirements? I think that's the biggest piece of advice that I would have. But also, as hard as it is to not overthink things, to try to be objective with the process, know that it's nothing personal. Sometimes there's only so much room in these graduate school programs, and they can only take so many students. And so it doesn't mean that you're not a good student for the program necessarily. It just may mean that maybe next year is a better year. I think that something else too, and I won't spend too much time on this, but is trying to avoid the things that can be upsetting on social media or online. The constant comparison of yourself to other people can be, it's hard enough when you're sitting in a lecture hall with 50 or 100 other people, and you know that everyone in organic 2 probably wants to go into healthcare. Not all of them. Surely we have some great, scientists out there. But that alone is enough comparison to feel really stressful. And then when you're bombarded by these things from all angles of your life, you really just need a break from it. And so I think stepping back and giving yourself a mental break from that can be really beneficial. And then it's some advice that my mom has always given me, is that everything feels better in the morning than it does the night before. So don't change your mind at night that you don't want to go to that graduate program, or that you don't want to take your big test the next day, or whatever it may be. Just sleep on it and think about it again in the morning.
I'm so glad you brought up the whole comparison game, especially with social media, because that's definitely something that I think is affecting a lot of people right now who are, like a lot of undergraduate students looking to start our careers. But I think especially those of us who are pre-health, and from my perspective, it especially affects women. It can be a really, really difficult thing to just, obviously always be comparing yourself, always seeing someone else's accomplishments. And, even if you wish them well, you look back at yourself and you're like, why couldn't I have done that? Or why didn't I work harder? So one of the questions we had prepared was actually about imposter syndrome. And I wanted to ask if you had ever experienced that. And I want to ask the other members of the e-board who are here too. I think that'd be great for us to talk about from the student perspective. Because it's definitely something I've experienced, and I'd like to hear how you guys kind of maybe work through that on your own. I've had a bit of practice with that just because I am someone who definitely compares myself to other people. I think we all are to an extent. So I always try to remind myself that there is no one to imitate. There is no one to try and fake being. You are only you. There is no standard. There is no right recipe to get into medicine, as Dr. Adams said. So I try to remember that each one of us is going to be different. Each one of us are going to have contributed to different places and learned different skills during our paths to medicine, which sometimes helps me. So I was curious what you guys thought, if you have any any tips and tricks for our listeners? Because I feel like we probably all have experienced this at some point.
Yes. I think I would be lying to you if I told you I still don't have imposter syndrome sometimes. I think, unfortunately, at least for me, it's one of those things that never goes completely away. To your point, I think everyone contributes something unique and something different to not only the healthcare field, but whatever profession they may have. I think that it's natural to feel imposter syndrome sometimes. And, certainly there are probably people out there who don't encounter it, and I wouldn't say that I feel like an imposter all the time, but there are definitely those moments sometimes where you're like, should I actually be here doing this? Like, I sometimes joke and I'm like, one day, like, someone's going to realize that I'm not really sure that I know how to do all of this. And it's like, sure you do. You show up and you do it every day. You do know how to do it. But we are often our own biggest critic, because for some reason we think that everyone else around us is deserving of the success that they've had, but we don't want to allow ourselves to be deserving of the success that we've had. And so some of it's just being fair to yourself when you have accomplishments. If you think that you have made it to where you are by accident, that's most certainly not the case. You've all worked very hard and you are working very hard. And so whatever it is that you accomplish is because you've worked for it, especially with the competitive nature of health professions now. I know it's always been competitive, but it feels even more competitive now. And so I think if you can remind yourself how many hours you've put in, remind yourself how many hours you studied for that last organic chemistry test or your last calculus test, and know that you are giving it all that you've got and you're doing the best that you can. And that, to Bethany's point, how, what you're doing is independent of what other people are doing. And so I think that, and also what Bethany mentioned for women, especially, if we look at the typical societal norms and things that we feel like other people are expecting of us, that can often make you feel like even more of an imposter sometimes. And so, I think that if you just even look at your resume or your transcript and look at all of these classes that you've taken, all these other things that you've balanced while you're doing it. And it's certainly not easy. I think that to that point, one of the best pieces of advice that a PA gave me, he was actually a PA on my first day of work ever in the pediatric ICU, which you can imagine probably how much of an imposter I felt like as a brand new PA in an ICU on my first day of work. And you could argue that maybe I was an imposter at that point because I really had a lot to learn. But I remember one of my colleagues telling me that if I ever showed up to work and felt like I knew everything that day, then it wasn't the place for me anymore. And that wasn't the job for me anymore. And so I try to remind myself of that still, even more than 10 years later, because we can't or shouldn't have the false expectation that one day we'll just suddenly know everything and say, okay, I don't have anything else to learn anymore, because that's definitely not true in healthcare. Like we already talked about, things are changing rapidly all the time. And so I think if you are continuously reminding yourself that you'll always have something to learn tomorrow, that almost takes off some of that pressure from today, because you're saying, okay, I can't possibly learn all of this today, or it's not, it's humanly impossible to know everything at once. And so you're giving yourself the grace to learn it tomorrow and to acknowledge that you can continue learning over the course of your entire career. And that doesn't mean that you're not capable of doing your job, but it means that there's always room to improve or room to expand your knowledge, and that you will never show up and say, I don't have anything to learn today. There's always something to learn. And so it's kind of a scattered answer, but I think imposter syndrome is an endless battle. And I think that even if people don't admit to you that they have it, they probably do. If we surveyed people, I think we'd be surprised at how many people admitted to it.
We should definitely do a survey. Yeah, no, definitely to go off of what you said, Dr. Adams. My mom continuously reminds me every single day to take each day one day at a time. And because I know for myself that I tend to do a bajillion different things, and then I get to the one thing that I'm supposed to be doing, and I feel like I'm not supposed to be there. And I have dealt with imposter syndrome like nobody's business, and I know I'm going to continuously probably going to be dealing with it. But I do try to just step back and reflect on what I have done. I know Dr. Adams, you touched on like writing down the amount of hours that you have or what you have done. I think reflection is a really important step for not only everyone else around you, but for you as a person, because you get to reflect on the person you were and what you can become. And I just feel like reflection is really important. So, and I have done a lot of reflection. So I do think when it comes to imposter syndrome, I do think that reflection is important.
Yeah, I really this was such an insightful topic because like I think for myself, like especially as a woman and then like being a first generation college student, it's so hard to like not have imposter syndrome because it's like, USF is such a big STEM school, so pretty much everyone you meet is a biology student, kind of going towards the same thing. And it can feel like a lot of the times, even for myself, that I'm behind in some way. It's like, oh, am I supposed to be doing research now? Oh, am I supposed to be working in a hospital and getting all these hours right now? And it's something definitely like I still struggle with today. And just even hearing how that's still something that you're struggling with, it just shows that something that like is never going to really escape, but it's just something to really learn how to really conquer. And I loved how you said how it's just really overall just celebrating your victories. Like I think that's something that really helps me is just seeing how far you have come and that you wouldn't be in this position if it wasn't like you weren't meant to be there. And I think that's something that really helps me is because like when I do celebrate my victories, it helps me to see like, okay, this is something that I am meant to do. And I think something else that helps me too is like I know a lot of the times when I have imposter syndrome is like especially times where I am burnt out from school, or especially those times where I don't like take that time to step back, to rest, to take a break sometimes because it's like from, especially with having such an intense major or intense field, it's like you can be so all in, but then you kind of like there are those times where it's like you kind of feel off or like you kind of feel very tired. And so like I really liked how you talked about like when you take that time to reflect, it's kind of very healing for yourself. And I think overall just learning how like even with failures, just seeing that as a time of growth. Like I really liked how you talked about like, especially for people who do maybe have to apply to, grad school maybe more than once. I know for me like that's something that is actually a fear of mine is like waiting on to like taking multiple gap years, like because it can feel like, oh, like if I do that, am I being behind? Am I not on the pace as everyone else? When it's just like sometimes you just have to go the pace that you can and go the pace that is meant for you, and that everyone's timeline isn't the same as yours. And if things don't go your way, it's not, a total failure, but it's a time of growth. It's a time of reflection. So, thank you so much for that insight.
Yeah, you all have very great points, and I particularly like Olivia, your mom's advice to take it one day at a time. I think everyone benefits from that, even not even just related to grad school, but sometimes with life in general when things feel overwhelming. Knowing that sure next week might be stressful, but what do you need to do to get through today and tomorrow first to be successful in those days before you can go on to the future. And to Wedline's point of feeling behind, I think that's part of imposter syndrome sometimes too. I remember as an undergraduate, I had 1 year between undergraduate graduation and PA school. And at the time, it felt like an eternity. Like I was like, I can't believe I have 12 months that I'm not going to school. I'm so much farther behind than everyone else. But that's really that was my perception of things. That's really not the case. Even if you had 5 years between undergrad and graduate school, the timeline that we set ourselves to is really, it's fictitious. And so it's something that we are unfairly holding ourselves to. Who sets this timeline? It's arbitrary. And so you hear about people who go back to school in their 40s and their 50s, and we have the time, and the time passes anyway. And so using it however you may want to is beneficial. And so I think that the big thing is just reminding yourself that what this timeline that we perceive as acceptable isn't the right timeline. Whatever timeline you end up having is the one that's right for you, and it will look different for all of us and for everyone that you meet. So that you brought up a lot of really good points.
Yes, most definitely. On the topic of imposter syndrome, we're going to switch over. I have a question about burnout, because I know, Wedline, you mentioned burnout, and I feel like burnout is a very relevant topic in healthcare, especially in the pre-health world, before we even get to the point of starting our careers, because the path to our career is quite vigorous. So, my question to you, Dr. Adams, is have you ever dealt with being burnt out, and how would you suggest to someone who may be burnt out or who maybe feels like they're on the path to being burnt out?
That's a good question. I think that, like you mentioned, burnout is very common, unfortunately, especially in the healthcare field and also the pre-health field. And this is purely anecdotal and just based on my own experience. But I would say that I feel like burnout has gotten worse since the pandemic, because of healthcare shortages and because of the large number of people who have been able to switch to remote work too. When you're constantly bombarded with other people who are able to work remotely, that sometimes makes our job feel even more taxing, because you can't work remotely as a PA. Usually, there are some jobs out there where you can if you do telehealth or something, but in general, it's something that is very much like feet on the ground in the hospital or in the clinic, wherever it is that you're working. And so I think that burnout comes in a lot of different forms and looks a little bit different for everyone, because it will depend on what stage you're in your education or your career, what other external factors you may have or you may be dealing with in your personal life or your home life. And then also what sort of things you're doing at work on a day-to-day basis. How many patients are you taking care of? Do you have enough help from coworkers? Do you have any coworkers? Even is it just you? Do you have other team members? And so I think that it's very unique. I have certainly experienced burnout. Being exposed to very sick patients all the time is something that I think contributed to me feeling burnt out. Sometimes despite your best efforts, your patients don't have good outcomes. And when you feel like that's happening over and over and over again, it feels like a losing battle. And it's certainly not something that's good for your mental health. So my biggest piece of advice is to find some sort of outlet, something that allows you to step away from your studying, something that allows you to step away from your stress at work or whatever sort of stress you may have. And whatever that looks like for you will not be what it is for someone else. If you're an artist and you like painting or you like creative writing or you like to exercise, doing something even for just 20 minutes. And I think separating yourself from whatever it is that's making you feel burnt out can go a long way, especially doing it regularly. And I won't spend too much time on this, but I received a book as a gift from my mom last year called 100 Ways to Change Your Life. And it's really, I recommend it to anyone. I think it's very beneficial and broken into 100 very small chapters. Like some of the chapters are only a page or two. So it's nice because you can pick it up and read it in any order. You don't have to read them all like from 1 to 100. You can read whichever order you want. But the author, Liz Moody, talks a lot about, doing small things throughout the day that can contribute to making you feel better as a whole. And whether that's, making sure you get enough sleep at night, because everything feels worse when you're tired. And so I think that if you're exhausted all the time, then you're more likely to feel burnt out. But if you got, I don't know, everyone varies, 6 hours, 8 hours, however much sleep you need. If you're consistently getting enough sleep, you're more likely to approach stressful things in a way that won't feel as overwhelming because you're better equipped to handle it. The same thing with like, I don't know, eating breakfast. That was always a big thing in my house growing up. Like, oh, you have to start the day with breakfast, which is true. So, doing things to help set yourself up for success. And so, and I want to give credit where credit's due. And I had made a note about this because it's something I've implemented recently to help prevent burnout. And so I wanted to share it with you all. And I don't remember if this came from that book, 100 Ways to Change Your Life, or if I encountered it somewhere else, but I have saved it to a note on my phone because that's where I tend to go if I need some sort of wisdom or advice. And it's called the 5 pillars of success. And so if I'm feeling like I'm not even necessarily burnt out, but feeling extra stressed out one day, or particularly like anxious for some reason, I open the note and it has 5 things on there. So have you made social connections? Do you have good nutrition? Are you in your usual routine? Did you get enough sleep? And have you had any movement? And if any of those things are lacking, that could be contributing to feeling burnt out or feeling stressed out or feeling poorly. And so I think having some sort of reminder for yourself that kind of forces you to check in and say, why am I feeling like this? And what can I do to help make it better? If you know that you slept horribly last night, that's an easy fix. Hopefully the next night you can sleep a little bit more. And that's some advice I always try to give to our PA students too, that if you are to the point in your education where you're having to stay up all night to study for the test tomorrow, there are probably other things that you can implement moving forward that will prevent you from needing to stay up all night the night before, because it's, in terms of just retention of material, that's not the best way to do it, but it will not benefit you in the long run. And then the busier your schedule gets, how many nights do you stay up? If you have 3 tests this week, are you up 3 full nights studying? And so I think finding a way to, balance that for yourself moving forward.
I just wanted to hop in real quick. I'm so glad you addressed kind of that side of burnout, because I think something I didn't even really realize until very recently is like how based in like your physical state it is. Like, I just think there's this mentality of like, people glamorize all-nighters, they glamorize like grinding, like, oh, I spent all day in the lab today, oh, I just got home, like I've been running all over campus all day. And I mean, that's just it is physically exhausting and physically taxing. And if you don't take time for yourself to eat a proper lunch, and you don't take time for yourself to just rest, not looking at your phone, not doing anything, just kind of rest and close your eyes for 15 minutes during the day even, it makes such a big difference, because I just feel so physically exhausted sometimes when I get home, and it's like, how am I even going to study now? I'm not going to, I would be a bad student if I didn't, stay up a few more hours and forego sleep to just cram more material into my head. But ultimately, that's just not a sustainable pace, is what I painfully realized. So I'm very glad that you mentioned that side of it, because I think it's something that's said a lot, about personal wellness and keeping yourself healthy. But we can say it again, like, it's so important. And it sucks to realize it yourself through trial and error, basically.
Yeah, I definitely agree with that. And I think, it would, again, be wrong if I'm sure at some point I was telling people I stayed up way too late, but especially now, I can't wait to go to bed at 9 o'clock every night. And I don't care what I'm missing. Granted, I'm not studying for a test tomorrow, but I think that, knowing you have a good night's sleep equips you more to study tomorrow, and your time is used more effectively and efficiently when you're not exhausted. And so it seems like such a catch-22, but you almost have to force yourself to overcome thinking that you should stay up all night, for example, even. And then just one other thing I wanted to share, because my sister always reminds me of this if I'm being hard on myself, is to be as kind to yourself as you would to a friend. If Bethany was telling Wedline, like, oh, I feel like I feel like I'm such a failure, I feel like I'm not studying enough, like, surely as a friend you would say, no, you're doing great, look at all these things you've accomplished, you've had such a busy week. You're allowed to tell yourself that too. And so I think we tend to be our own biggest critic sometimes, but just be as kind to yourself as you would be to a struggling friend, because you deserve to treat yourself that way too.
Oh, 100%. My mom, like, religiously always would say to me and my sister, treat people how you want to be treated. And I also feel like your environment and your mental health also takes a really big toll on how you go about your daily life and how you're able to complete an assignment or take a test and everything. And one thing that I will always love my mom for is that she would always put me and my sister to bed at 9 o'clock every single night, and I still have not shaken that. So I still go to bed pretty early, maybe not at 9 o'clock, but more around like 10:30. So, but I still get a full night's rest. Thank you, Mom. But I
Yeah,
do
very important.
Yes, I do agree with everything you guys have said, that sleep is important, eating a good balanced meal is important, and exercising is also another thing that's super important that I've also noticed. I've noticed like the times that I don't get a good workout in or something, like I can see how my mood is affected by that, or how I'm able to like finish my homework or something. Like I can see how that stuff like really takes a toll on how I'm able to perform in school. And yeah, I just think taking care of yourself is really important. Self-care. We talked a lot about that in our first episode. So self-care is very important. Wedline, did you have any thoughts?
Yeah, I really loved how, like, basically, kind of like everyone said, like, how, it's overall really protecting your inner peace and really taking care of yourself. Like, I love what Bethany said. Like, I think it's over glamorized to just not take care of yourself, like, to do the all-nighters, to cram, to, like, and especially, I think, as, like, pre-health students, we have, like, the tendency to overwhelm ourselves by doing, like, working a job, doing all these classes, and then doing research or trying to get as many extracurriculars as we can, to where it's like we can kind of fall off from that. So I loved how you talked about, just, I think, taking the time to eat, taking the time to go to sleep. And I think for myself, it's just also like making a schedule, like finding ways where I can balance everything. And then not feeling like I have to like take on all these tasks to feel good about myself, or to kind of, I think, just do that whole glamorized pre-health undergrad look where it's like you're doing all these things but you can't handle it, or you're only doing it but just for the look of it. So I really just love the idea, especially with just like, I think overall it's pretty simple, but I feel like sometimes we can overcomplicate how, like, undergrad life should be. So yeah, thank you so much.
Yes, 100% Wedline. I agree with everything you just said. So we're gonna move into one last question. It's still related to the topic of health. So my question to all of you guys is, when you guys are you wake up and you're kind of having a little bit of a rough day, or you're struggling a little bit to get that homework done or study for that test, or in your case, Dr. Adams, like getting up and going see patients and getting yourself through the day, how do you guys overcome that or take the steps to try and have a better day?
That's a really good question. I think, one thing that I tried to implement with myself really early in my career was telling myself that my day would be dictated by how I approached it and not by things I encountered at work. Because you never know what you're going to encounter at work. You never know exactly how many patients you'll have or exactly how sick your patients will be, or how much time you'll need to spend with each of them. But just knowing that if you try to approach it with a positive attitude and even say like, I'll get through the day one way or another, you tend to be less affected by those external factors, because despite us wishing we could pawn our bad day off on something else, it's really all about our perception. So if your perception is that you're going to have a terrible day, you probably will have a terrible day. And that's not because of anything anyone else has done to you, but because of how you're approaching the day. And so I think, it's definitely like last Sunday is a good example. I don't know if you all were in town last weekend, but it was like raining from all night Saturday, all day Sunday. And I worked last Sunday. And so getting out of bed and dragging myself to the hospital in the cold and rain was definitely not my perfect idea of a Sunday. But I also have to have some perspective and remind myself that my day is much better than my patients. And I'm lucky because I have a job and get to go to work and have the physical health to work all day. And so I think if you can remind yourself of, what you would have said 5 years ago, if someone said that this is what you'd be doing today, would you reply differently? Like if 5 years ago someone would say, oh, you'd be thriving at USF as undergrad students doing, getting these grades in these classes, you would probably have been happy with that. And so I think just reminding yourself that you've worked really hard to get where you are today, and you're lucky to be in the position that you're in, to be at a great university and to have supportive friends in groups like this. And so I think trying to lean on the pluses in a situation rather than the negatives, because the negative things tend to drag other people down around you too. I know if I'm around someone who's really negative or complaining, I tend to complain a lot more too. And, sometimes it's easy to complain, right? We all have, nothing's perfect. And so, I don't like to fool myself into thinking that a situation's perfect, but I do like to try and remind myself that I have control with how I approach the day. If you approach the day with a better mood, you'll be better off.
Yeah, I loved what you said, just everything, how everything is about perception, because I find myself like if I think a certain way, that's how I'm going to act. Like despite all the external things that are going on around me, usually like my day is pretty much controlled by my own actions. And so I think something that also helps me is just like I loved what you said, finding things to lean on, like finding those little things that can help you cope or like help you throughout the day, whether it's like having supportive friends or even just having things that you love to do that can like, for me it's art or any type of like artistic feature, whether it's drawing or music, like having those things to where it's like it can kind of help you with your mental health, or it can kind of um help you along the day. Is honestly very important, especially with like I loved how you said earlier about COVID. I think ever since COVID hit, mental health has been such a growing factor. Like I believe I don't want to mess up the statistic, but I read how by 2030, like anxiety would be about in 70% of most students, which is kind of scary because it's just like, COVID happened like a few years ago, but there's been such a big impact by it. So it's just like students deal with a lot of mental health issues, and especially with like, us being adults for the first time out of high school, being away from family, like there's a lot of things that I know for me, can make me pretty like shaky if it happens. So it's just like, especially finding like what grounds you and just kind of um, finding ways to go to that each day. But also, I love what you said. Overall, it's just about your perception and finding ways to control how you think, controlling your emotions, whether it's through journaling or praying, or just taking time to like sit and like, okay, like this is something happening, but just trying to finding ways to ground yourself. So thank you.
I'll go next. I think that you're so wise to say that, Wedline. I feel like these are not conclusions I came to until very recently, like within the last few months, all of this emotional control thing. My poor mom would probably be disappointed in me if they hear me say that because she's been trying to drill that stuff into me since high school. But it's so meaningful. I'm so glad to hear you say that, because I do think, I mean, this is another thing that is said all the time, but it really is a mental game. Like, the situation and the circumstances that you're faced with can be workable or they can't, depending on how you approach them. And I feel like I've been having a lot of personal experiences, especially in this last year of college, where there are days where you wake up and you don't want to go to class, you don't want to sit on the meeting that you scheduled yourself, all of these things where you're really having to drag yourself kicking and screaming through it. But it it's better to phrase it to yourself, and to think of it and frame it in a way that it's not you're dragging yourself through it kicking and screaming. You're excited to take on this challenge, you're excited to follow through on what you said you would, and show people that they can trust you, and show yourself that you can do something that's difficult. So having that mentality about it and controlling your emotions in that way, and not allowing yourself to go into that spiral of negative thoughts, and things like that, it's still a work in progress for me, but it's a labor of love for myself and for others. So I'm happy that you said that, because I feel very similarly. And then, just in a little bit more of a tangible and practical way, this is another echo of Wedline's comment, but taking time to give yourself those little joys throughout your day that can kind of help boost your mood. So for me, it's like listening to music that I like, or taking some time to doodle, or just, anything like that. Look on some Pinterest for a while, like, just to kind of infuse your life with a little bit of that color and joy, and say, okay, even though things are difficult right now, there's still these silly things out in the world, or there's still this beautiful stuff that I have always enjoyed, and I can continue enjoying even as I'm working hard, in things that are more academic or more serious, throughout the day. So I love that we're on the same page.
Wow, I don't even know if I could top any of what you guys just said. Yeah, you guys all had very good wisdom, and I will say I definitely have struggled with a few hard days, just like everyone else. And it's definitely taken some getting used to change my routine and see what works for me and what doesn't work for me. Because I will say I went to community college my first 2 years, and then I transferred here to USF. So I haven't moved out of the house yet. So moving out of the house was a very big transition for me, and not having someone consistently on me about, oh, Liv, did you do this today? Or did you do that today? Did you do your homework? Did you get all of your homework done or whatever? So I definitely would say, for me at least, I like to work out, get all that pent up frustration out. I like to write down in my planner what I need to do for the day. Having a schedule works for me, and I love cooking. Cooking definitely helps a lot, but I will agree that on days where it does get hard, being positive is probably one of the most important things to do, because being negative is just not a good thing. Nobody wants to be negative. So let's all be positive. All right. Thank you all so much for your wise words. We're going to move into talking a little bit about women's heart health. So I would like to start off the conversation and say that before talking about women's heart health, um, heart issues do run in my family. My grandpa struggled a lot with heart issues. He had about 4 open heart surgeries, so there was a lot of stuff wrong with that. But after doing research on this topic, I saw some crazy statistics for women's heart health, and I genuinely thought that it was mind-blowing. So I found that, one, heart disease is one of the leading causes of death in the US, and I feel like I knew that fact already, but I kind of like blocked it out in some way. So I thought that was crazy. And 1 in 5 female deaths are due to heart disease, and obviously heart disease can affect any woman at any age and any race. Well, heart disease impacts all women differently. So I thought that was very crazy. And I came across this one interview or TED Talk on YouTube. And it was an interview with Dr. Jane Wright. She said that over 60 million women are living with some sort of cardiovascular disease, and yet only 56% of them recognize that heart disease is their number one killer. Let me tell you, that like blew my mind. I truly think that knowing about heart health is very important because it could be affecting anyone. And more so now that I've looked into it more, I will probably look into it even more because it runs in my family. So these statistics are absolutely insane, and I just feel like it's so important to bring awareness to women's heart health. So do you guys have any thoughts about women's heart health?
Yeah, I can definitely go next. I at the last tea event, hosted by AMWA in February of 23, which is a year ago. Wow. There was a woman who worked there. She was a cardiologist and specifically for women. And so she worked with a lot of pregnant women, and she was telling us about that specialty and really that niche within that specialty, even because it wasn't something that even she herself knew about when she started in her internal medicine residency after medical school. But she was really kind of creating that department herself at Tampa General Hospital and within USF Health, and a few other centers and kind of little spaces like that are cropping up around America just because there's there's increasing recognition of the fact that heart disease, as well as many other pathologies, are going to affect women very differently than they do men. We go through different phases in our life, including, pregnancy and menopause and all these different things like that. And even outside of a woman's own biological timeline, our bodies are just different in general. And so including gender of all kinds in the consideration of how we treat patients and how we deliver them care and how their diseases and their injuries and everything like that presents in the first place is so important. And I'm so glad there are people at USF who are doing that work. And she said she really had to advocate for herself as a practitioner and for her practice and that little subspecialty in her field, because people would discount her and say, oh, so you're only a woman's cardiologist, like, why is this even a thing? Why, like, how are you even employed? Like, how do you have a job, a roof over your head being a woman's cardiologist? But really, I mean, her practice was thriving. There were people who needed her help in that very specific way. And so I'm glad that increasing recognition is kind of being owed and given to, gender specific medicine. And I think we should continue to consider that as budding health professionals.
Yes, really quick. I'm sorry. Another thing that Dr. Jane Wright said in the TED Talk that I watched, she also touched on the fact that how different treatment could be for men and women in the case of heart health, and how the symptoms of a heart attack or some type of heart disease could be a little bit different than what a man would experience. And I thought that was very crazy. Touching on what you said, Bethany.
Definitely. I've heard, I mean, this is more anecdotal, but I've heard that women often don't realize they're having heart attacks because they discount their own pain, and they, like, even through pain of menstrual cramps and childbirth and things like that, they've felt worse, like worse pain than a heart attack. And so they might be feeling some chest discomfort or tingling or anything like that. And they go on with their day because they say, well, this is, I'm just having a little bit of shortness of breath. Meanwhile, an actual heart attack is happening to them right there. But there's so little education about heart disease specifically, and it's kind of considered more of a male thing, as many diseases are. I mean, maybe they're not considered more of a male thing, but we just know so much more about how they manifest in men than we do in women. And so, as women ourselves, not only as health professionals, but as just people who have bodies who want to stay healthy, that's something I feel like we should remain cognizant of and try to educate each other on a more, familiar level, just to keep each other safe and make sure that we're not, I don't know the term other than gaslighting ourselves out of feeling the way that we feel and being heard by our medical professionals.
Yeah, I think you both bring up a lot of really great points. I, of course, don't work in women's health, but as a female and a healthcare provider, I think it's really important to educate your friends, your families. I think, to Bethany, to your point, education is a huge part of compliance. And I think in particular with heart health, like Olivia pointed out, heart disease is the #1 killer of people in the United States or in women in the United States. And, I was reading something the other day about how, women, especially as we get older, start thinking about like, oh, I'm nervous about getting these certain types of cancer and I need these cancer screenings like my mammograms, which are of course very important. But we need to also remember our risk of heart disease. And I think this is even more applicable as we were talking about, imposter syndrome and burnout and how stressful things can be, because all of those types of things contribute negatively and certainly contribute to our risk of heart disease if we're having all of this stress all the time and we don't have good outlets. But I do think that education is one of the biggest ways to help decrease the number of women that are affected by heart disease. I often realize in talking with even family members that sometimes the reasons people are not compliant is because they truly don't have an understanding of how something will negatively impact them. If their healthcare provider said to them, if you don't exercise or you don't, stop smoking or stop drinking or change your diet, I think we tend to have these blanket statements sometimes, but by educating our patients and letting them know that there's a balance for everything, there's that line where there's too much of something and you should try and have things a little bit more in balance. But if our patients truly had an understanding of what things were contributing to their heart disease and how they could modify them, I think we would really be shocked at the amount of compliance that we had, and hopefully those numbers would go down. I do think that if people knew that if they went for a 2-mile walk 5 days a week, that sounds like a lot, but it would take less than an hour for someone to do. And so if someone knew that that could mitigate their risk of having a heart attack, then they may be more motivated to find the time to do that. And so I think that really a lot of it comes down to education, because I was also, admittedly shocked when I saw those numbers too. I was like, I mean, it's something that but you tend to forget about it, right? And I can share this, I guess. I know we don't like to talk about age, but my mom turned 65 this week. And so I was telling her about this podcast and how I was invited to talk with you all. And I sent her this particular statistic that I'm going to share with you all. And it says between the ages of 45 and 64, 1 in 9 women will develop symptoms of some form of cardiovascular disease. And after age 65, the ratio climbs to 1 in 3 women. And if my sister replied like, oh, wow, that's something to look forward to, of course, kidding, hopefully. But 1 in 3 women after 65, that's huge. That's so many people. And so if there's something that we can do by educating those around us and educating our family members, we certainly owe it to our fellow women out there, and men too, not to discount them, but to your points, I think that we tend to take on a lot sometimes and tend to minimize the pain that we're having. It's very well proven that pain, even in healthcare, is not always taken as seriously in female patients compared to male patients. And so if we're minimizing the symptoms that we're having, like, oh, I just don't have time. I don't have time to have this chest pain, then it's definitely something we tend to put off. And so making sure that you're paying attention to your body and, actually seeking healthcare advice if you're experiencing these symptoms.
Yeah, I really loved what you said, and I can relate a little bit to you, Olivia, because my grandma, she has like an enlarged heart, and then my dad, he has had like history with like having heart attacks. So I'm very big on like heart health because I know it runs in my family, and I loved what you said about education because like my family is Haitian, so like a lot of healthcare education they kind of miss that scope just because of kind of like I loved what you said about like kind of like that mindset of just working, especially when it comes to underdeserved communities or those from foreign households. They don't get as much access to healthcare or access to that education as possible, to where it's like if they do find out that there's something that they're in risk in, it's it's a lot more later in life. Like my grandmother, she found out about like her enlarged heart pretty much when like a year or two ago, when it's something that she was at risk for a very long time. So I loved what you said, like the importance of education, especially to those who don't really have as much access to it, because it does make such a big impact as to like how they can really take care of themselves. So yeah, thank you for talking about that.
Yeah, I think it's really disheartening and just upsetting about our healthcare system in general when someone like your grandma's age, for example, makes it to whatever age she is and says, like, no one has ever told me this before. Because the first thing that comes to my mind is like, where have we failed people as a system? And we owe it to people to do better, and people deserve better access to healthcare, regardless of some of the social determinants of health that you mentioned. We really owe people more than what we give them sometimes. And so I think that, that's a big change that we can contribute to as, future healthcare professionals, regardless of what career paths you choose. We all have to take responsibility for our healthcare system and how our care is delivered. And so if you can even make a little difference, it can really go a long way.
Oh yeah, 100%. One thing that I have realized after doing all of this research is how important it is to take care of yourself and to create healthy habits. And like you all mentioned, educating yourself on a topic that affects so many women today. So it's definitely important. So thank you all for your wise words. I appreciate it very much. We are going to start closing out. So we have some future updates about our club. Bethany, you could take it away.
Okay, by the time this podcast posts, we will have hosted our February 26th town hall meeting, which is going to be a discussion about women's challenges in medicine, our perspective, which we are hoping to host women and men at that event. So we're super excited. I guess hope you guys enjoyed it because it will already have been done. But we'd love to advertise our upcoming suture clinic. We had a great time at this event last semester. We're running it again this semester. We hope to make it a twice a year thing in the future. It's going to be on March 7th. That's a Thursday night at 5:30 p.m. and it's in MSC 3707. That's the big room in the back of the third floor. We're going to have a guest speaker there, Dr. Seminario. She is a gastroenterologist at USF Health, and she's going to help us suture on some bananas. It's super fun. It's very educational. You can come out and practice your suturing, maybe for the first time, for a lot of you. So we'd love to see you there. Thank you so much for listening to the podcast.
Yes, thank you, Bethany. And if you all want some more information about our club, I'm going to link our Bulls Connect, our Instagram down below in the description, so you can always join us on our Bulls Connect. We upload our PowerPoints and we upload other resources that we find for shadowing and for volunteering. We have past guest speaker contacts. We have a wide variety of things that you guys can go and take a look at. So I just want to give a big thank you to Dr. Adams for coming on and speaking to us today. We all thoroughly enjoyed having you on here. So we thank you very much for that. And I hope you guys enjoyed.
Thank you.
Of course. I hope you guys enjoyed the episode, and we will see you next time.